Hi, my name's Jeff Cave. I'm the district vet based in Wodonga, and in this webinar I'm going to discuss some of the livestock health issues to consider this coming spring. At any time, it's possible to anticipate the upcoming animal health issues by considering the preceding current and forecasted seasonal conditions. In another webinar in this series, I discussed reasons why trace element deficiencies are more likely this spring of 2020. But just to recap, the good pasture growth in many areas throughout autumn leading into winter meant that the intake of trace minerals via the soil was less likely to have occurred. And also, rapidly growing pastures are naturally lower in trace minerals. This may be further compounded by rapidly growing pastures in spring. Hence, trace mineral deficiencies such as iodine, selenium, copper, or cobalt deficiency are more likely this spring, particularly in young growing animals such as calves and lambs. We therefore recommend that you review your trace mineral supplement strategies this spring. Climate models predict a wetter than average spring in northern Victoria this year, and this gives the potential for abundant spring growth. With abundant spring growth, losses due to enterotoxemia or pulpy kidney and bloat, which I'll discuss in a moment, become a distinct possibility. Enterotoxemia is caused by a toxin produced by Clostridium bacteria, which is found in the bowel of normal cattle and sheep. And enterotoxemia occurs when a large amount of readily fermentable feed is present in the bowel, leading to rapid multiplication of the bacteria and a lethal level of toxin production. Due to the rapid progression of the disease, an animal affected by enterotoxemia will usually simply be found dead in the paddock. And young stock in good condition up to 2 years of age are most commonly affected. However, deaths may occur in older stock as well. And little can be done to treat an animal affected by enterotoxemia, and therefore the emphasis should be on prevention. And the key to prevention is to ensure that livestock are adequately protected through vaccination. As with any vaccination program, adult cows and ewes should be vaccinated approximately 1 month prior to lambing or calving to give their calves and lambs maternal or passive immunity through the colostrum. And that passive immunity lasts approximately 6 weeks, after which the calves and lambs need to be vaccinated to gain active immunity, and that's done by giving 2 injections at least 4 weeks apart. A feature of the enterotoxemia vaccine is that the duration of immunity that it provides may be quite short. It may only give 3 or 4 months of protection. Therefore, a booster dose should be given before a high-risk period, in other words, before the beginning of spring. Bloat occurs in cattle following the rapid consumption of lush, fast-growing, immature legume, that's clover or lucerne dominant pastures. It's seen much less commonly on grass-dominant pastures. And we've already seen cases of bloat this autumn on some of the fire-affected pastures which had abnormally high contents of clover. So bloat's caused by an increasing gas pressure within the rumen or the paunch as the feeds are fermented. And the gas builds up in the rumen as small bubbles or foam that cannot be belched out when the animal chews its cud. So the first sign of bloat is a tight distended abdomen, particularly on the left side. But on occasions, all that's found are many bloated animals dead in the paddock. And death from bloat can occur quickly, sometimes within 20 minutes of grazing dangerous pastures. So the emphasis must be on prevention rather than treatment. And the way to prevent it, hungry cattle should be prevented from gorging themselves on the dangerous pastures, and hay should be provided prior to introducing cattle onto danger paddocks. In addition, a range of medications are available to help prevent bloat, and these include bloat blocks, bloat licks, medicated capsules, medicated water supply, drenching and pasture spraying. And the suitability of each medication varies upon the circumstance. But in actual fact, many bloat deaths may actually be due to pulpy kidney. And the reason for this is that bloat slows down the passage of food through the gut, allowing the pulpy kidney bacteria to multiply and kill the cow. Another condition that may be seen on abundant spring pastures is Dystocia, or difficult births, due to overly large calves or lambs being born to overly fat cows or ewes. It's important to monitor body condition score and target calving cows and ewes to be in a body condition score of around 2.5 to 3 at calving or lambing. For more information or advice, either speak to your local veterinarian or call an Agriculture Victoria Animal Health and Welfare staff member. You can also call Agriculture Victoria's Customer Service Centre on 136 186 and they can refer you to an Animal Health and Welfare staff member. So thank you for listening and all the best for a good spring.